it is my great honor to introduce Hyepin M of our Faith and Community Empowerment. Hyepin, it's great to see you.
Good to see you again. Thank you so much for this invitation and for your leadership with Dr. Murthy. I have to say that it is such a change of air with the new administration when you in leadership, that there is great hope, and I see the tangible changes and the world opening up. So again, thank you, thank you, thank you. This morning, or yes, it's still this morning on both coasts, I'm here to represent the voices of over 400,000 houses of worship in this country. For us, even when the COVID shuts the world down, we are still open. As you say, the spirit of generosity, service, selflessness are very much at the core of people of faith. Yeah. And so for many of us, we have been open, providing food, providing medical care, providing the human touch, even in spite of the danger and the threat of COVID-19. As an organization from the start, we have been connecting resources to our faith leaders so that they might be able to share with their congregation, whether it's distribution of masks, where to get the vaccines, vaccine codes. We've been partnering with the governor's office, coordinating all efforts with the mayor's office, with mobility, vaccine units, and others. And we've been hosting forums, sharing, again, information, the truth, because there's a lot of misinformation that is spreading. I've learned such things as that is the COVID-19 vaccine is like the mark of the beast, and it's just unbelievable of that. And so again, being able to share that communication. We have over 35,000 names in our database of leaders, including faith organizations, business organizations, community-based organizations, elected officials, and such. And so again, I think that our voice has been missing and in many places, but again, faith organizations are integrated into every sector, every segment of society, geographically, nationally. And I have to say that they really serve as first responders. My parents were called to ministry. They thought they were going to preach the gospel, save a lot of souls. They did a lot of that, but in essence, they ended up becoming unpaid social workers, because not just my parents, but all faith leaders, people look upon them with trust. They're accessible, and they're free. So in many ways, they are the first people that people go to. But again, more than anything else, it is about trust. I also want to say that I'm here today to also be a voice for the Asian American community. You know, over 20% of doctors in the United States are Asians. Almost 10% of the nurses in this country are Asians. 1 out of 4 are frontline workers or in essential business. And yet one of the doctors recently said in a press conference, they are treating us like the virus when we're treating the virus. And so again, I just want to lift this up. Use us, leverage us. We have the space, we have the volunteers, we have the heart, and we have the trust. And so again, we're here today to partner with you and to help spread the good news that the world is coming up, that there is a solution for many of us to get back and be part of the world. Thank you, Vice President Kamala Harris.
Thank you, Hyepin, and I really appreciate you mentioning the experience that far too many of our Asian brothers and sisters have been having. You know, from the beginning of this conversation, Dr. Tuckson has a campaign saying, make it plain. That means also, in my opinion, keeping it real and speaking truth. And I appreciate you making that point, and I think we all know as a collective, as a coalition, as a community, and as a country, we all need to speak out against the hate where we are seeing it, and we need to remind our fellow human beings that they are not alone, and we will stand together. wherever and whenever we see that kind of hate being expressed. So thank you, Hyepin, for bringing that up.
Thank you so much. And I do want to point out that I know that the COVID-19 has had a disproportionate impact on communities of color.
Mm-hmm.
A lot of times the Asian community, like in city of LA, May 2020, had the highest death rate of any group. In New York, recently, South Asians and Chinese had the highest positive COVID-19 infections. I'm just giving you a couple of examples. And yet, we are not included in many of the talking points. And I think that leads also to Asian Americans not being able to pay attention because we're not being talked about on the news, on the talking points, on the PowerPoints. And so I would like to really just advocate the inclusion of Asian Americans in these disproportionate impact of COVID-19 on lives. As well as, of course, the faith organizations. Again, another group that oftentimes get left out in the public discourse.
Thank you.
Because we are valuable to this country.
Thank you. And Dr. Murthy knows because he's been a leader in our administration on this, together with Dr. Nunez Smith. It is very important to the president that we speak truth and address racial inequities across the board, but on this topic in particular in our healthcare system. And again, these disparities existed long before. When we look at the rates of infection and death in the Asian community, and African American community, Latinos, our Native community, the
Yes.
numbers are really unacceptable.
Yes.
And
Yes.
tragic. And in terms of the impact on these communities, of course, profound. And so this is something we have been addressing. That we have a racial equity task force that is very much a part of our whole approach to this. And in addition, you will often hear the president and all of us talk about the importance of equitable distribution of
Yes.
resources and support. And so to everyone here, and again, I'm going to look at the whole group, to everyone here, I thank you. I thank you. I thank you for your work, for your time, for your leadership, for what you are doing to boost the confidence of the people who need to know again that they're not alone, for reminding folks that it is within each person's power to actually make the choice and make the decision to get vaccinated, and to in so doing to save their life. Right? It's within each individual's power. And I think there's been so much about this pandemic that has isolated people, literally isolated them, but also isolated folks emotionally, making people feel alone. And as we all know, when folks feel alone, it can strip them of their sense of their power. And so part of this whole collective and this approach, this community core, is that we know there is power that we give the individual when they see that they are not alone and that we are all in this together as a community. And that is very much at the essence of this whole approach and what we are doing today and what you as founding members are doing. It is about reminding our fellow person of their power and that we see them, that they matter, and that we're gonna help each other out. So, there's a reason that COVID-19 Community Core is at the core of our public education campaign, and the work each of you is doing is gonna make a huge difference. You're saving lives, and I'll tell you, just as a housekeeping note, there's gonna be a social media toolkit in your inbox now to help you continue your work. And we will be in touch with you with more resources in the days ahead. Be in touch with each other. Everyone can see, I'm sure you see people you know. Let's all be in touch with each other, and we can do this. We can do this. So thank you. And Dr. Murthy, thank you always for your leadership. Thank you all, everyone. And be well, be well, be well. Be well. Thank you.